We have been discussing various forms of premature ejaculations. On this particular episode, we're going to deviate a little bit, not talking about premature ejaculation, but going to talk about a retrograde ejaculation or dry ejaculation. In order for ejaculation to occur, we talked about premature ejaculation is predominantly in the brain, such as neurotransmitter deficiency. But for ejaculation to actually propel the semen out of the body, it depends on two mechanisms. Number one, for the closure of the bladder neck. Number two, propulsions or contractions of the actual smooth muscles in the prostate so that the semen can propel out of the body. And how does that happen? It requires neurological coordinations. So there are three reasons why people get retrograde ejaculation. Number one is actually aging process. When a man gets older, the prostate gets bigger, naturally the actual closure of the bladder neck is deficient and therefore you will encounter problem with premature ejaculation. Number two actually is related to medication. The most common medication that can cause premature ejaculation actually is alpha blockers. You may recognize alpha blockers is a drug that we use for high blood pressure and also prostatic enlargement. So the purpose of that is to extend or to open up the bladder neck, and that opening up the bladder neck will inevitably cause the sperms or the semen to go backwards into the bladder. And therefore, after somebody has climax, when they urinate, they will flush out all the semen and then including the sperms. And one last reason why people actually get the problems with retrograde ejaculation is actually related to neuropathy. Neuropathy is a condition where the nerve itself is damaged. For example, the commonest reason why in Malaysia is diabetes that resulted in diabetic neuropathy. Other well-known medical conditions such as multiple sclerosis or even strokes and also Parkinson's disease, and all these sufferers actually cannot ejaculate. However, the sperms actually is going backwards into the bladder. The retrograde ejaculation itself actually doesn't cause any harm to your body. However, if somebody is trying to have a baby, for example, somebody who suffers from type 1 diabetes and actually facing the problem of ejaculatory disorder, and then they will also face a problem of infertility. So how to overcome this? Actually, that is with help of science. Whenever we can actually retrieve the sperms after somebody actually ejaculated, and then the sperms in the urine itself will still be healthy if it's retrieved early, and with the help of that, one can actually do artificial reproductive technology or test tube baby to create a baby for the next generation. For the first month of February, and when we're venturing into Chinese New Year and also Valentine's Day, we're going to talk about the medicine of love. Stay tuned for next week's Putting Dr. G on the Spot.